All right, I think we're going to go ahead and get started. So again, welcome everybody to MHDO's webinar on reviewing the recent changes made to our data submission rules, Chapter 243 and 247. My name is Karen Lee Harrington. I'm with the Maine Health Data Organization, and I will be kicking off today's session. And then our partner with our data management team, Leanne Candora, will pick up the remainder of the presentation and walk through some of the details. So with that said, just a few reminders. Please keep your phone muted. Submit questions as we go along through the chat feature, and we'll address the questions either as we're going through it or at the end. And for those questions that we need to get back to you on, we will do that in writing and post the responses in the portal. And then, as I mentioned earlier, a recording of this webinar will be available on the MHDO website. So just a couple of things. We want to make sure that we get through an overview of the changes for your submissions specific to Chapter 243, which is the rule that governs the submission of claims data, and then Rule Chapter 247, which is the rule that governs the submission of non-claims based payment data and other supplemental healthcare data. We'll talk about the annual registration timeline and reminders, and then we'll open it up to questions. So I'm going to try and level set, and I apologize in advance if this is going to be confusing, but I'm going to do the best I can. The MHDO Board of Directors adopted revisions to Chapter 243 and 247 in December of 2023. And at the same time they adopted changes, they also authorized me to reopen up Chapter 243 to revise the structure that we had proposed around the submission of data for capitation. And the reason why they did that is because at the last minute, we got some feedback from some payers about what the board had adopted or were in the process of adopting for the capitation structure in December. And so we said, we know that there are some concerns with it. There are some things that we can do that will better meet the needs of the payers in terms of structure. So we want to reopen up the rule. And because of just the way the process in state government with noticing the rule and public hearings and comment periods and all of that, the earliest that the board could then adopt those changes once we went through that whole process was in June of 2024. So in June, the board adopted changes to what we had originally proposed and they adopted in December. So the long and the short of it is all of the changes, what was adopted in December of 2023, and then what the board adopted in June of 2024, and again, that was specific to capitation, those all go into effect in January of 2025, so that when you submit your data for in January of 2025, and that date is due for most of you in February of 2025, it will incorporate all of the changes. The reason why there is such a delay is because, again, as part of the public hearing and comment process, we had heard from many payers that they wanted more time to implement these changes. So that's why there's such a delay. And today, again, the purpose of today is to make sure that you're aware of these things and that you are starting to work on them accordingly. For Chapter 247, there were changes that went into effect in December of 2023, or let's put it this way, the board adopted changes in December of 2023, but those changes, like 243, do not go into effect until January of 2025, which for this rule means when you submit your data in August of 2025, it will incorporate the new structure. So if we go to the next slide, this might also help. Oh, okay. Before we get to this slide, I think we're going to talk through, just as a reminder, what you're submitting next month under 247 is following the structure that's in place today. So again, these changes that we're talking about, 243, 247, don't go into effect until 2025. And we'll talk more about that, and Leanne will underscore that as we walk through the presentation. The next slide. So this is a link to MHDO's website where all of our documentation regarding rules are posted. And I wanted to bring this to your attention for a couple of reasons. One, there's a lot of detail in the documentation that's posted under changes adopted in December of 2023 and changes adopted in June of 2024. The basis statement / summary of changes document that we are required to put together is a good place to go to look for the specific changes that have been adopted. And it also provides a rationale for why we are making those changes. As we've said before, and it may not feel like it, but I want to just reinforce the message that we don't collect data just to collect it. The changes that have been proposed and adopted are a reflection of either A, data that we need to comply with mandated legislative reporting, and or B, feedback from the users of this data that in order to use the data in the manner in which we want it to be used, additional data and or clarifications in what's being submitted needed to be made. So in the basis statement, summary of changes, you'll see our rationale and the specific changes that have been approved and adopted. I think at this point, I'm going to go ahead and turn this over to Leanne to walk through some of the specifics. And I just want to underscore that we're not going to go through in painstaking detail all of the revisions. Instead, we want to bring to your attention those that are probably the most substantive that you'll want to, if you haven't already started to plan and think about. And we also wanted to make sure that you've got the resources to begin to look at these things. There'll be a testing period that Leanne will talk about. We want to help support you in any way that we can so that come January of 2025, you're in a really good place to comply with these new requirements. So with that said, again, thank you for joining us this afternoon, and I'll turn things over to Leanne. And Leanne, you're on mute.
I turned the video on, but I didn't unmute myself. So thanks, Karen Lee. We're really excited to continue to work in partnership with MHDO to ensure that we can collect the highest quality data possible to support MHDO through these efforts. And so, as Karen Lee mentioned today, I'll really just be going through at a high level some of the changes in each of the rule chapters. But the link, and I had also posted the link into the comment or the chat feature, just so you had that direct link handy, that provides all the detailed information, but we're also happy to answer questions that you have during today's webinar. So first, we're going to start with the Chapter 243, which is the claims data sets. These changes, as Karen Lee mentioned, will go into effect January 1st, 2025, and the January data is submitted within the month of February. So this is more of the data set that are submitted monthly, and there's been some new changes to Chapter 243 that are just really important for us to discuss today. The first is the inclusion of de-identified substance abuse disorder claim information. We've gone through in a lot of detail some of the information that the ways in which we've updated the rule chapter to ensure that the collection of the substance abuse disorder information remains de-identified through the submission of those data to MHDO. This, as you may be aware, is a very important set of data for state health policy, but we also want to ensure the protections are in place. So the SUD related records must have identifying information removed from them when they're submitted to MHDO. And there's also a field that we call the SUD flag that indicates both in the medical claims and the pharmacy claim files that particular claim line is substance use disorder related, and that field should be set to Y. So in the MC file, it's 333. In the PC file, it's PC 113. And though that would indicate that that claim is substance abuse disorder related. There's a variety of other fields that indicate that the field should be left blank if that substance abuse disorder flag is set to Y. There is a note on one field, MC068, which should have included that note to leave blank, that we're working to get the updated documentation on the website just to include that note. The patient control number should also be blank if it's a substance abuse disorder flag. Karen Lee, is there anything you wanted to add about that particular note? So as I mentioned, we're going to reshare this information and the updated documentation to ensure that all fields that could have identifying information, so that service dates, admission dates, other date fields, they should only indicate the year of service, and substance related records must have information such as claim number and line number removed, so there'll be no way to link records. All substance use disorder claims for a given member must be assigned the same unique ID, that's in MC336. This field should be left blank on all non-SUD records. So just to reiterate, this new structure and requirements are designed so that the substance abuse disorder claims are de-identified upon submission, and there's no way to link substance abuse disorder related claim lines to non-substance use disorder records associated with the same individual. In addition, MHDO's data use agreements protects the confidentiality of individuals and unauthorized use of the data, in addition to all of the other work that we're doing to ensure that these records remain de-identified. In addition to the work that we've done to collect the substance abuse disorder information, we've also added a new file type. This is a capitated payment file. Capitated payment information shall be reported for every month that a member is covered under a particular payment arrangement, regardless of whether services were provided. Capitated service records documenting any services provided to a member in a given month should continue to be reported in the medical claim file. So this is, like we said, a new way that we're trying to ensure that we have all of the capitated payment information that we would need to support MHDO and Maine policies. And so we've needed to add this new capitated payment file type, and the information needs to be submitted every month just along with all of the other required claims data files. If you don't have capitated payment arrangements as part of your services, we will have a way to indicate that upon registration. So in addition, we recognize that there could be capitated payments for substance abuse disorder related claims. So this may be applicable, it may not be applicable, but to ensure that we're able to collect capitated claim information, we've also put some rules in place to ensure that those data also remain de-identified. So substance use related records must have identifying information removed and the SUD flag set, and all related records for a given member must be assigned the same unique ID. So the similar information to reporting SUD claims on the other file types. So there's been some other updates that you can find in the Chapter 243 reporting requirements. We've added some additional definitions around pharmacy benefit managers, rebates, substance abuse disorder. We've also retired obsolete and unused data files to sort of clean up the submission requirements, and also obsolete or unused external sources. And we've also changed the spelling of payer with an ER to OR to be consistent. So that's the summary of changes to Chapter 243. The next section is going to go into more details around the Chapter 247 requirements. These changes go into effect in 2025. And as we've noted previously, files containing the 2023 data are due next month in August, and the changes that we're reviewing today are going to go into effect next year. So there is no changes to what's being reported in August, this August, and the changes that we're reviewing are for next year. So there is also a new file type for Chapter 247. The prescription drug rebates, or DR. It's for non-claims-based prescription drug rebate data. The collection of pharmacy rebate data improves the transparency and accuracy of the prescription drug reporting. And so this has enabled us to add this new requirement so we can start collecting prescription drug rebate information to support other state-required reporting requirements. So some of the other changes to Chapter 247, we've clarified descriptions around the substance use disorder data elements to better distinguish their differences, and added data elements such as total plan paid dollars for substance use disorder claims-based payments related to primary care to account for non-behavioral health SUD related payments. We've updated some of the language in the summary to provide more specific overview of what's contained in the rule chapter. We've reorganized and clarified some general requirements in response to data submitter feedback and data end user feedback. So as a reminder, we use the feedback that comes in, so please don't hesitate to send us feedback that will help all of our data submitters better be able to adhere to the requirements. We've also deleted data elements such as insurance type product code as the field is not used, and we've deleted the definition of redacted payments to align with other rule chapter language. And then there's just been a variety of fields where the descriptions have been modified. So that is some of the changes that were made. And just a reminder about some of the supporting information files that are required when non-claims-based payments or the NC file type and or aggregated redacted claims-based payment data or the AC files are required. Supporting information are also required. So this is true for your submissions this year and as well as next year. Sample supporting information or files are found in the portal. So here's just a little link to that or a screenshot of what that looks like for resources. So another reminder, files containing the 2023 data and attestations are due next month. No changes, and files containing the 2024 data and attestations are due August 31st, 31st of 2025. These attestations must be completed in the portal. So now we're just going to go over some overall registration updates, timelines, and reminders that apply to both rule chapters. All of your user accounts have these features, and we just wanted to remind you, if you've ever forgotten your password, you're able to use the Forget My Password feature on the login page. Your user permissions can be changed by administrators for your companies, and if the administrators are no longer with your company, please contact the MHDO help desk for assistance. This is the one thing that we aren't able to automate within changing contacts. Is if administrators change, that's something that needs to be done through the help desk. So updates to registration information. While we have the annual requirement every January that registrations need to be updated, administrators should update user permissions and contacts as often as needed to maintain timely, focused communication. So we know people may move or change positions throughout the year, and it's really important that those contacts stay up to date, and that administrators carefully review and revise the payer details prior to confirming on the annual update, because compliance is based off of that information. So at a minimum, all portal registration information needs to be reviewed and updated annually during the month of February, and the next annual registration is due February 28th, 2025. So as a reminder, around the review and update of summary information, there was a non-claims-based payment question that was added, and that helps to ensure that we understand the types of non-claim-based programs that you have, and that this also helps support compliance against reporting information for those programs. And there's also a question around redacted medical or pharmacy claims. So just a reminder to ensure that information is correct and up to date. And a couple other reminders around data submission. When information is not known or unavailable, leave blank rather than providing system defaults. And it is also preferable to explain and override a profile level failure because a field does not meet the population threshold than it is to request an exemption for invalid content. Also, some reminders about resolving validation issues. You must resolve structural level validation failures before attempting to resolve any other failure types. So once those structural level failures have been resolved, then you can move on to work through any other validation failures. Also, for those exemption override requests, the start and end date should cover the date range for the data, regardless of when the exemption is requested. So it's about the dates of the data, not about calendar dates. So we're going to go through some important timelines. So for chapter 243, the timeline in front of you is really about the implementation of the changes for chapter 243. Please continue your regular monthly submissions for 2024 in the meantime. For the changes that we just discussed today, we will have a payer testing period that is optional, but this helps to ensure that the changes, especially now that we've added a new file type, that you're able to adhere to those requirements and the validation rules. So we are planning a payer test period starting in December. And then instructions regarding annual updates will be emailed next January. And then the last day for files of any period will be accepted in an old chapter 243 format at the end of January. And then after that date, all new data will be processed under the new format requirements. And so that's just a really good date to keep in mind. Submission of files in the new format begin January 2025, begin February 2nd. And then at the end of February, the annual registration information updates are due, and the January 2025 data files in the new format, and also with the drug rebate file, which is the new file, or I'm sorry, the capitation file, which is the new file for chapter 243. For chapter 247, as I just mentioned, the 2023 data and attestations are due next month in August. And then for the new chapter 247 changes, there is also an optional payer testing period that will happen in early to mid-June in 2025. So a few months before those data are required. And then the submissions of the 2024 data in the payer data portal will start in August. So it'll be August 1st through the end of August for the 2024 data files and attestations. So really excited to have everyone attend today's webinar. I hope that overview was really helpful. We just want to make sure that you have all of the support resources that you need on hand. I'm going to also hand it over at this point to Karen Lee to say any last words and if people have questions that they want to put in the chat. Karen Lee?
Thank you, Leanne. Just a couple of things I wanted to underscore. You'll see the contact information for the help desk for technical questions. And then you'll see for compliance issues, my name. And I just wanted to let you all know we are still working on recruiting to fill the position that Philippe Bono, that many of you worked very closely with over the years, has retired from. And we've had a number of applicants, but unfortunately, we're still in the process of trying to find the right person. So until such time, I'm your contact person and I'm doing my best with some colleagues supporting me. So if you're not getting what you need, please email me with an urgent in the subject line. But we'll keep you posted as we continue to work towards filling the position. And we're also working on contracting with Phil to come back and to provide us not full-time, but a couple of hours each week to kind of help us as we're going through this transition. So again, we'll keep you all posted. And I apologize in advance for any delays. But we're doing our best. And if I am not responsive, again, please email me with such a note. The other thing I just wanted to reiterate, when Leanne was talking about the MC068 field and the fact that it was an oversight on our part to not include the same language that's included in all of the other fields regarding identifying information. If it's sub-related, we don't want it. So we will be updating the documentation online to make sure that that note is also included or instruction in the MC068 field. That was recently brought to our attention. Again, it's an oversight and my apologies for that in advance. So on that note, I have been monitoring the chat and it does not look like we have any questions that were put into the chat. Here is one from Patty. Question on chapter 243, ME119, cost sharing reduction indicator. Should the default 0 or null? Leanne, I don't know if that's something you can answer or if we're going to need to follow up in writing on that question.
I will take a look, but probably let's follow up in writing for sure before I give an off the cuff response.
So Patty, we will put that question to the team and get something back in writing in response. Are there any other questions? And where there aren't hundreds of us here, if you don't want to put your question in the chat, just unmute yourself and ask. Okay, hearing nothing, I don't want to keep people. I know you all have busy schedules. Please, again, do not hesitate to reach out to us for questions as you begin to prepare your files to meet these requirements. We want to try and help support you in any way that we can. And again, appreciate your joining us today. And we will, as I said, update the documentation and also provide a written response to the question that Patty just raised. I hope everybody enjoys the remainder of your summer. And it feels like before we know it, it will be fall. And as you work on these things, again, don't